Hello, everyone. Welcome to TCOYD. I am going to discuss diabetes and dental health today. My name is Dana Berliner, and I am a registered dental hygienist with 33 years of clinical experience, and I am a graduate of the University of Southern California. Today, we will be talking about the very real and important connections that exist between your oral health and diabetes. Oftentimes, patients don't associate systemic diseases with their mouths and oral health. There is a unique and important interconnection between oral health and diabetes. Diabetics are 3 times more prone to getting periodontal disease and tooth loss. And diabetes is the only systemic disease that is a direct risk factor for periodontal disease. Some key takeaways I would like you to take from this video are: number 1, controlling your blood glucose levels helps to control your oral health. Number 2, controlling your oral health helps to control your blood glucose levels. So these two go hand in hand. Number 3, inflammation is a major cause of bodily destruction and a key risk factor you must try to eliminate. Here's a quick picture of inflammation, and this happens to be gingivitis, which is the inflammation of the gums because of this plaque, this white stuff. We'll talk about that more. So today the topics will be: number 1, basic oral anatomy and terms. Number 2, plaque, tartar, and inflammation. 3, how oral health affects diabetes. Number 4, how diabetes affects oral health. Number 5, diabetes, obesity, sugars, and inflammation. Number 6, ways to control your diabetes with better oral health habits. And number 7, diabetes, oral health, and pets, one of my favorite topics. So we'll start with the basic oral anatomy and terms. We'll talk about the tooth structure and then the gums. So the structure of the tooth: this is a crown. This is the white part you see in your mouth, and the crown is covered by enamel. The crown is the exposed portion of the tooth covered by enamel. The dentin, which is the next layer in, this is the yellow area underneath the crown. The dentin is a soft layer protecting the pulp. The pulp consists of nerves and vessels, blood vessels. The roots you can see are buried in the bone here. This is the bone. These are the roots of the tooth. And a tooth is held into bone by fibers and ligaments, which are very tiny around the roots here. And that's what helps anchor the teeth into the bone. This bone fiber ligament structure is called the periodontium. And if the periodontium is destroyed, your tooth can fall out. That's the basis for periodontal disease. So here you have a picture of healthy gums. And the gums, another word for the gums is gingiva. Gingiva equals gums. You have the ending itis. Itis equals inflammation. Gingivitis equals the inflammation of the gingiva or the gums. Periodontium equals the fibers, ligaments, and bones that support the teeth. Periodontitis is the inflammation of the periodontium. That's where ligaments and the bone all get destroyed. Periodontal disease equals the destruction of the gingiva, the fibers underneath, the bone, and everything that supports the teeth. So periodontal disease is what you don't want to get. Plaque, tartar, and inflammation. We'll start with the plaque overview. Plaque is a whitish, sticky biofilm that is produced 24 hours a day, 7 days a week. It is a bacteria that multiplies constantly. Everybody produces plaque in their bodies. There's no stopping it, but there is controlling it. If not removed daily and nightly, it will harden. Hardened plaque we call tartar or calculus. As you've heard, tartar control. Well, basically hardened plaque, when this is sitting on your teeth and gum line and you're not removing it, it hardens, and it hardens within a day or two. So then you can't get it off. That is called tartar. So if plaque hardens into tartar, hardened plaque or tartar creeps under the gum line, starts infecting the gums, and gingivitis begins. Gingivitis equals red, swollen, inflamed gums that hurt, bleed, and start the inflammatory process. And if not removed soon, the fibers, ligaments, and bone underneath start getting destroyed. Inflammation worsens and can travel throughout the body. At this point, the bone is being destroyed, the teeth may loosen and fall out, and that is periodontal disease. When the tartar is still under there, it must be removed by me, the dental hygienist. We try to get that out before you lose your teeth. Getting control over plaque, tackling plaque. Daily and nightly oral cleaning routines are a must. So if plaque is controlled, it should not cause problems, both for diabetics and non-diabetics. So no plaque buildup equals no inflammation. If plaque is not removed daily and nightly, the uncontrolled diabetics may experience a more dramatic and severe effect, leading to periodontal disease or tooth loss at a much faster rate. And the inflammation created in the mouth may also create widespread inflammation throughout the body. It's very important. The plaque contains sugars that may spill into the bloodstream and increase blood sugar levels. How oral health affects diabetes. It all starts in the mouth. Again, the rising plaque levels, if not removed, can lead to elevated blood glucose levels in the mouth and the elevated sugar throughout the bloodstream. That leads to increased inflammation in the body. It can lead to higher infection rates and longer healing times. So, how uncontrolled diabetes is affected with the brain, the teeth, periodontal disease and gingivitis, nerves, you get neuropathy in your feet, eyes, retinopathy, the heart, heart disease and stroke, and the kidneys are affected even more. Remember, diabetics are 3 times more prone to periodontal disease than non-diabetics. Diabetics are also at an increased risk of the kidney damage, eye damage that can lead to blindness, the heart disease and stroke, nerve damage and neuropathy of the feet, digestive issues, delayed wound healing, and increased chance of infections. How diabetes affects oral health. Uncontrolled glucose levels travel through the body and enter the mucosal tissues of the oral cavity, wreaking havoc in the mouth. Some of the potential negative effects of uncontrolled diabetes on your mouth are, number 1, again, gingivitis and periodontal disease. You see the swollen, bleeding gums and deep pockets, which occur under the gums, with subsequent loss of bone and teeth. Number 2, xerostomia, or dry mouth. The excess blood sugar impairs salivary glands, which can decrease the production of saliva. And when you have minimal saliva, it makes it harder to talk, to swallow, and to chew. In addition to that, if food sticks to your teeth because there's no saliva, you can be at much higher risk for tooth decay, cavities. Number 3, thrush or yeast infections. Excess blood sugar creates a sticky white yeast coating the tongue and the inner cheeks. That's a fungal infection. Number 4, you're at higher risk for gum abscesses and infections with pus. Number 5, burning mouth syndrome. This is from the increased blood sugar also creates mouth sores and weird burning sensations in your mouth. Number 6, you get fruity keto breath. Acidic chemicals called ketones are produced when insulin levels are low. Number 7, taste disorders. Number 8, persistent bad breath, which nobody wants. Diabetes, obesity, sugars, and oral health. Having diabetes is not easy, and having uncontrolled diabetes is even harder. So we'll talk about obesity and adipose tissue. So obesity, or the increase of body mass or adipose tissue, creates an even worse condition for uncontrolled diabetes. Increased adipose tissue leads to greater insulin resistance, in addition to more inflammation throughout your body. It also releases hormones and cytokines, thereby exacerbating bodily and oral inflammation. Limiting sugars and healthy eating. When you ingest excess fatty foods and sugars, the chances of diabetes worsening increases, and the whole body is negatively affected. When you constantly add sugars such as soda, candy, syrups, honey, and other sweetened foods and beverages, it not only bombards the bloodstream with glucose, but also increases the chance of cavities, as you can see. Eating a lot of sugar creates acids, it just sits on the teeth and eats away at the enamel, and then down through the dentin to the pulp, and it is a mess. You don't want root canals, etc. Incorporating fresh fruits and healthier foods, less added sugars, and regular exercise all help to lower blood glucose levels and reduce the chance of tooth decay. Ways to control diabetes with better oral health care. Create simple routines for yourself, morning, noon, and night. When you create a routine, it becomes part of your day. It's easier, you don't have to think about it, and it's done. And without a simple routine, you just go throughout your day, you think about doing something, and then the next day comes and you haven't done it. So it's really important to create easy routines for yourself. Number 2, brush. Brush with an electric toothbrush 2 to 3 times per day. I feel electric brushes are much more effective at removing this plaque, which is what you need to do to keep the inflammation away. Using manual brushes is okay too. You can use them both. But I do feel electric toothbrushes are much more effective at getting under crowns and under bridges and getting in the back and all sorts of things. I just think it's a much more effective way of removing the plaque. Number 3, brush your tongue. Bacteria multiplies overnight, coats your tongue, and creates bad breath. A lot of people have the misunderstanding that while you're sleeping, the plaque does not multiply, but it does. It forms even worse. So you're going to wake up and you have all that nasty plaque in your mouth and on your tongue, and you're going to walk around with that all day. That's not good. So brushing your tongue in the morning is a really good, helpful idea. Number 4, floss. I say morning and night before you brush. Flossing, again, in the morning, people wonder why. And I tell them, floss in the morning because you are removing that plaque that's been built up all night long while you're sleeping. Before you brush is a great idea. That way you do it and you get it done. Flossing is the most effective at removing plaque under the gum line. Also at night, you want to floss again, also removing plaque, but you're also removing food debris. And you don't want that sitting between your teeth all night long because that will create cavities. Number 5, use a fluoride toothpaste that helps to prevent cavities and replenishes the teeth with minerals lost due to sugars and acids. Again, when you eat and drink, it the food produces acids, and if it sits on your teeth, it will demineralize, which pulls the fluoride ions out of the enamel and makes them weak and more prone to cavities. When you use fluoride, you add that fluoride back into the enamel. It's called remineralizing, and you're strengthening the enamel. Number 6, use other dental aids to remove plaque. I love floss, and I also love all these other items. And I know a lot of my patients hate flossing. They don't want to do it. It tightens their fingers. Their hands are too big. I've heard it all. However, there are other things you can use that will help to mechanically remove the plaque. You've got water picks, water flossers, floss threaders, which are great for people with bridges and braces. Rubber tips, interdental brushes, which are really great. Those are these guys here that are little brushes that you go between your teeth with. And toothpicks, if you use them lightly. All of these help to remove plaque. Number 7, get professional cleanings 2 to 3 times a year. Hygienists like me, we remove the tartar or the hardened plaque that creates the inflammation and destroys the bone, that periodontium, the fibers, the bone underneath. So when you come in to get your teeth cleaned, we get under the gum line and clean all this off so that the plaque and tartar don't stick to your teeth and root surfaces and increase that inflammation. That's why it's real important to keep up with your professional cleanings in addition to doing your part at home. So the key is preventive care to mechanically remove plaque daily and nightly. Removing plaque and tartar leads to less inflammation and sugars, which can lead to healthier blood glucose levels, which can lead to healthier mouth and body. Diabetes, oral health, and pets. Dogs and cats produce plaque and tartar and therefore are subject to gingivitis and periodontal disease. Once periodontal disease sets in, a vet must remove the tartar with your pet anesthetized and or pull teeth, unfortunately, if that periodontal disease is too severe. And just like humans, pets get diabetes, they get kidney disease, bad breath, and oral infections. So to protect the pets, in addition to lowering your vet bills, it is very advisable to brush their teeth at night with a pet formulated toothpaste and a toothbrush that they will tolerate. 2, you can feed them vegetables and other healthy crunchy snacks. Number 3, get them checked by the vet at least once per year, and if necessary, have the vet professionally clean their pet's teeth. Number 4, keep them exercised and loved. Some final words to remember. Inflammation in your mouth is preventable. And the better job you do in keeping your mouth healthy at home, the better controlled your diabetes and blood glucose levels will be. And as you can see, oral health has a major impact on your whole body's wellness, especially if you are diabetic. And taking a few minutes each day and night to brush, floss, exercise, and watch your sugar intake will make a huge difference in your overall health. Thank you, everybody. Stay well.